Are you a parent that has had to deal with a child up late at night crying, tugging on their ear, and dealing with chronic congestion and pain due to an ear infection? I know this breaks your heart, seeing them like this, and has made you worry now every time that they start to get a bit congested or a common cold that it may spill over and build up into another chronic ear infection. Maybe they've happened so often and that your only solution proposed now by doctors is tube surgery. You've tried it all, whether it's rounds of antibiotics, one after another, visits to the pediatrician, and any natural remedy you can find online. Don't worry, parents, because you're not alone. This is the reality for 80 to 90% of kids who experience at least one ear infection before the age of 3. Now the real question is, what is the solution to get to the root cause of this problem? First, we need to understand what causes chronic ear infections. This is a recurring buildup of fluids, inflammation, and swelling that block the eustachian tube, leading to pressure and pain in the middle ear. This is a problem because your body's entire ear, nose, and throat, respiratory, and lymphatic system are all linked together. Think of it the same way as the plumbing in your house. When one area gets backed up and clogged, then everything else gets backed up as well. This is especially common in young kids who have flat tubes, which prevent that natural draining process. Now from there, we look at what are the 3 primary causes of chronic ear infections. First thing we see is poor plumbing and drainage. This is primarily due to misalignments causing extra tension, inflammation, and limited movement of the nerves and muscles that supply the inner ear, leading to that buildup. Next thing we see is an excessive sympathetic response. And the reason why this matters is when the body is constantly trying to deal with getting rid of sickness in a high inflammatory state, it causes the body to stay stuck in the stress stuck on standpoint, which causes further icks, mucus, and buildup. Next, we see an overconsumption of sugar and processed foods. That's a big cause. And the reason for that is that leads to a further much of that inflammation process, escalating these symptoms. And last but not least, we see an overuse of antibiotics and fever reducers. The problem is these simply affect the symptoms and don't get to the root cause of what's causing the weakening of the gut and immune system and actually further weaken it even more. So how can we tell all the effects that chronic ear infections are having on the body as a whole for your child? First thing we're going to do is we're going to take a deep dive into your child's case history to find the contributing causes as to why the ear infections are occurring. The most common similarities we see for children struggling with chronic ear infections are birth interventions and trauma, such as forceps, induction, C-section, and vacuum extraction, which places a greater deal of pressure on the upper neck area that supplies these nerves to the ear, nose, and throat system and allows for that first drainage system of the body. Next thing we see is health challenges as infants, such as colic, reflux, and constipation, showing that further buildup. And lastly, we also see that early exposure to antibiotics and steroid-based medications that we talked about earlier on. These things all layer on top of each other, furthering the body into an excessive sympathetic stress stuck on response. So the next thing we'll do in our office is we're going to use our state-of-the-art insight scans to evaluate the overall health of the nervous system and put the pieces of the puzzle together. Traditionally, this will show extra tension in the upper neck cervical spine, which is the neck region, which, as we discussed, is essential for that beginning drainage process, especially for the next lymph nodes. And then next, we want to talk about how chiropractic specifically is going to work. These happen with specific and gentle adjustments, which increase drainage and plumbing to get to the tension relieved to the nerves that are supplying the ear, nose, and throat system. And the great thing about this is we see drainage happen very often and immediately. So overall, then next thing we'll do is we're going to see a balance of that nervous system out of that fight or flight response and be able to reduce prolonged inflammation to more of a rest and digest state. And then next we see about how neurologically focused chiropractic care has actually been shown to be very effective in the prevention and treatment of even some of the most severe cases. In a retrospective study that was done, 93% of children with acute ear infections improved after chiropractic care. So if ear infections are a past issue that your child has struggled with, it's time to get them scheduled for those nervous system scans with us to see what effect it's having on their body as a whole. And it's time to get to the root cause of this chronic issue.